Good morning, Hong Kong. Welcome back to another edition of Hong Kong Insurance 101. This week, we're staying on topic with the Wuhan coronavirus outbreak, or COVID-19 as it's recently been rebranded, and talking about health insurance and how you're protected. Now, there's been a lot of confusion out there about whether individuals who have contracted COVID-19 are covered for the costs of their treatment under a Hong Kong health insurance plan. The answer is yes. Depending on whether you have an inpatient-only policy or if your policy covers outpatient treatment as well, the levels of protection your plan will afford you will be different. But all costs of treatment in relation to the Wuhan coronavirus are covered under a health insurance plan up to the stated policy limits. For example, if you have an inpatient-only insurance policy, you would be covered against your costs of medical treatment where an overnight stay in a hospital is deemed medically necessary. For individuals who have severe complications with this disease or individuals who have additional medical issues which would complicate their recovery from the virus, an overnight stay in a hospital is actually a very likely treatment route. The good news is that all health insurance products will have inpatient coverage at their core, even for basic plans. As such, should you become ill with the COVID-19 virus and require emergency inpatient medical treatment at a hospital, your health insurance plan will be there to protect you against the costs of that treatment, whether you are admitted to the Adventist, Canossa, or Queen Mary. Now, public or private, health insurance is there to ensure that you have the financial support to overcome this illness. The other side of this is outpatient treatment, and that is where you are seen without having to spend a night in a medical facility. A checkup with your general practitioner is a great example of outpatient medical care. Not all health insurance plans offer outpatient protection, and if your plan doesn't, then you are responsible for the costs of that care out of your own pocket. But outpatient treatment is generally far less expensive than inpatient treatment, and in Hong Kong, depending on the doctor you see, these costs can actually be pretty reasonable, especially compared to a country like the USA. If your plan does cover outpatient treatment, then your visit to a doctor as a result of a COVID-19 treatment will be covered. But outpatient coverage does have some restrictions, so be sure to check your policy wording or contact a CCW Global broker so they can walk you through what protection your plan offers. That's us for this week. Stay safe, stay healthy. As always, like and subscribe our channels to get all the latest content as it comes out. And don't forget to ask CCW. We're simplifying your insurance.